sorts, and then I'll let you ask more questions if you'd like to, but I'll at least do an intro.
Okay, there you are. So you can go ahead and start whenever you're ready. And I'm not
Sounds.
interviewing you, you're just talking. It's
Oh,
you
I'm
by
just
yourself.
talking.
Yep.
Oh, I mean, you can ask some questions if you wish. Go for it.
Okay. Okay.
Um, Alrighty. Hey, folks, this is Jordan Peterson with Aurora Behavioral Health. I'm here today for the Sounds of Autism Life on a Spectrum podcast. And I'm here. I just wanted to introduce myself first. So, I've worked at Aurora Behavioral Health here for about 3.5 years. I am the director of business development, and I got connected initially with Sounds of Autism and Cricket, who is the founder of Sounds of Autism, about 6 months into that, and really we connected. And I'll be honest, the biggest thing that really drew me in and the Sounds of Autism, cause and her mission that she brought to this was really being able to connect families with local resources in the community. And I just think that's one of the most important things that any family, anyone that's listening here, can really take away from this is just that, there's a lot of different organizations, there's different, well-meaning nonprofits, there's different things that are out there like that, that, they really do want to try and help, build awareness and do advocacy and kind of, accomplish all these different goals. And I think that a lot of these things they're very much a part of the Sounds of Autism mission. But I think that the biggest thing is that sometimes when those things start to get really big, they lose sight of, who are we really helping, and whose backyard are we talking about at this point in time, and how do you really connect with folks with the specific things that they need assistance with. And so that's something that Aurora, we've always been very proud to work with Sounds of Autism, because I think that's the heart of the message. That's the heart of what Cricket brings to the table here, is just how do we help families that are right here in our own backyard? How do we connect with these families? Even if it's COVID and we're talking through a screen, it feels like we're meeting in person. And so within that, we've been happy to be a resource to our community, serving, Aurora itself has served the community here since about 2006. We initially had a hospital open up in Glendale. So for anyone's unfamiliar with what we do at Aurora, it's not just a city in Colorado. Aurora Behavioral Health is actually the largest psychiatric healthcare system in the state of Arizona. And so a lot of the times we're known for our inpatient level of care, where we do a lot of things like, mental health with suicide prevention, but as well as substance use and detox. And we often work with adolescents and adults 13 years and older. But a few years back, we decided to try and meet a need of our community, and really identified who's in need of a different level of support. And in working with various great organizations, like including Phoenix Children's Hospital, we really identified that there isn't a inpatient hospitalization that is really fine tuned to working with kiddos diagnosed with autism and other developmental disabilities. A lot of times things are, medication focused, and medication is absolutely an important part of that process. It's a helpful tool, but it's not the one size catch all for everybody. And so really we opened up a unit about 3.5, almost 4 years ago now, over at our Tempe hospital. So we have 15 beds that are just dedicated to working with kids that they're not just in an acute crisis in that moment, but really it's for kids that their behaviors have really gone on this decline for a really extended amount of time. And it's gotten to the point where these behaviors are now starting to really become dangerous, maybe to just the individual, but also to family members. A lot of times we have families that are approaching us, and it's really common for us to hear, I feel like I'm walking on eggshells in my own household. I don't know how each day is going to go. We have good days, we have bad days. And really being able to have a specific behavioral program for this is our goal, is to really help those families the most. So we absolutely know that behaviors are something that we take a look at, and there's different challenges to that for every family and every individual. And so there's a lot of different outpatient providers that really can help out with some of those lower level needs, especially if it's things like, getting up and keeping, Johnny focused on homework, or, things like that. But then when you get into the bigger, scarier behaviors, like things that, are dangerous, punching, hitting, slapping, head banging, things like that, that they happen more often than your average person is aware of. And when those things really start to become frequent, that's when we get really concerned. And so for us, we developed a 45 to 60-day hospitalization program, where we really can work intensively with not only these kiddos, but their family members as well. So we provide a lot of caregiver education and training. And we really want to make sure that when, it's ready for discharge, and the child's going to go back to their family home, that parents feel really empowered and supported and have some of these tools, and they've been able to have time to practice these things and practice some interventions, set up your home for success as well. and really have a different environment when that happens. Because unfortunately, in the past, what we typically see with kids that are in this kind of crisis is, going to the local emergency room. They might get admitted for a few days. We might change a med, up a med, do something like that. And, that's when all of a sudden medications start to get out of kind of control after a little while. But it really doesn't fix the underlying issues that are there. It's kind of it's sometimes more seen as a band-aid solution versus, do the procedure, do the surgery that would help in this scenario. And so part of that is that it's a lot of hard work. It's a lot of hard work for the individual. It's a lot of hard work for the families. And we're very upfront and transparent about that with everyone that we work with. But it's something we've been really happy to be able to provide. And I'm happy to say that over the past 4 years, we've really been able to help several families, and really be able to see this success and stop some of that cycle of hospitalizations and things like that that have happened in the past. And so myself, I shared this. I've been working with Sounds of Autism for a while. I was hosting some monthly meetings for a point in time. Myself, I didn't always come from a business development background, which is my current role. I did previously work in more of a clinical setting, and autism was a population that I worked with the most. And so even though I'm kind of different in that way, that I didn't get into this field because I have a family member who has autism. I got to know autism from a professional setting. And so it's been a really wonderful journey, and something I cherish as part of my life, is being able to really learn more about the autism community. And I've really been able to see it from a behavioral side of things from day one, truthfully. So it's been a great, process, and it's been just a wonderful thing to be a part of Sounds of Autism and to feel included in this group here. And I lend myself to help out families that are in need. But I think if there's a big takeaway that I can give to anybody here, and it's that whether or not maybe someone, it could be your child, it could be a family member. If you hear about someone who's struggling with some things and they're saying, oh, these behaviors starting to kind of pop up, or, these are some concerning situations that have happened, first and foremost, I just want to let you know you're not alone. In fact, it's just like mental health, which is the primary thing that we do at our hospital. We do a lot of community education to really inform people that with anything like this, you're not alone. It's just, unfortunately, when we talk about the things that happen in our homes and things like that, or mental health or behaviors, that's not really casual talk when you're meeting with your friend at Starbucks all the time. It's not something we always feel comfortable sharing. Um, you might see somebody, occasionally post something on Facebook. And the thing is, if you feel like, man, I'm really starting to see more of these, just know that there's still so many people that aren't. Right. And it's because it's a difficult subject to really talk about. There's a lot of fear of judgment. There's a lot of fear of, am I a bad parent? Am I this, or am I struggling? And so there's so many different things that play a role in that. So if that's you right now, I just want you to know that you're not alone. And just because you're not posting about it on Facebook doesn't mean that it's not real and it's not happening to you or somebody that you know. And so I just encourage you, know that, and also understand that it's never too late to reach out for additional support. And so with autism, as it's talked about a lot of the time, the biggest thing that I can tell as a member of a behavioral health provider agency is early intervention is easily, you're going to hear those words so much that you just go early intervention, early intervention. And truthfully, it's kind of similar when people are like, in behavioral health, we have a comment where all of our staff members, we say self-care, and everybody pictures self-care as a bubble bath, but sometimes self-care is just taking a day off. But to really get back to that with early intervention, the reason that it's harped on so much is that, you don't want to wait for your house to catch fire before you actually try and start putting the fire out, right? You want to add some prevention in there, right? You want to make sure that you're not putting fireproof things or, things that are on fire near things that like to catch fire. So we want to make sure that we are strategically planning in that way. And so when we talk early intervention, realistically, for an individual diagnosed with autism or any developmental disability, oftentimes you can start seeing some of those signs. You can see some of the diagnosing things that somebody could diagnose for as early as, I've heard, 18 months. But most commonly, we definitely see between ages 2 and 3. And realistically, it's not too early to actually start with different services, get some consultations, reach out to some wonderful resources that Sounds of Autism helps connect folks with. And what I think is really important to consider with this is when you go to the Sounds of Autism website and when you find their resource list, a big important thing that I just love is that these aren't resources that are just coming out of a Google search. These are folks that Cricket and the team at Sounds of Autism have personally met with and can personally recommend to you, that they've been able to really vet and identify this is a service that's going to help you avoid some of the, it can be a scary world out there. And sometimes you're like, I don't know, this, this seems like maybe it could be a scam. It could be, this or that, or what's really happening. And I just think that really being able to trust and rely on one another is what brings just a uniqueness to this community in general. And I think that it's very much exemplified, and you'll find that out whether this is your first time interacting with Sounds of Autism. You'll find it out if you ever go to one of the meetings when things resume, whether it's virtual, whether it's in person, when hopefully that comes back at some point here, right? But I think you're going to feel that warmth and that sense of community just upon your first meeting with anybody here.
Thank you, Jordan. I'm just going to click us out of here. Oh, that was so good. Thank you so much.
Is that helpful?
Oh, very helpful. You know what? I love it, because what we're doing is we're taking like just a whole talking segment, and we completely break it up into different commercials, PSAs, stuff like that. And then I do raw and real. So the raw and real is that whole segment will go on there. So if somebody really needs all of that in one setting, they can get that. But if they want to fast forward, or they want to just see little segments of that, we can use that. And then we share all of this on Facebook, social media, LinkedIn, anywhere we can put it. And then we also, I don't know if you saw, but when you go to our website, you can click Life on a Spectrum, and then it goes right to your podcast page on YouTube. So everything's linked and connected to, I think we have 35, that's my dog, 35 podcasters right now that we have on there that go from prenatal till the end of life. Early intervention is Hisela and Rosemary. They're going to be doing that part of it. We have you, and then we do Alan Mason and the funeral planning and wealth management. We have how to buy a home, where to buy a home, just all kinds of different people that are, either parents of autism, they have autism, or they know somebody that is dealing with autism, very similar to you. Like clinically, you've worked with these people and you understand what their needs are. So we're able to utilize your resource, and they get a different perspective, which I think is really important. I always tell people you're not alone. So your wording is perfect for what we're trying to accomplish here.
Well, good. Glad I nailed it.
Well, I think it's great. I think you did a great job. And I told you, and I think you remember this, but so we're working right now. As soon as this walk is over, then the next step for us is going to be doing the benefit, dinner or breakfast, whatever we end up doing. But we will be inviting, it'll be invite only. So the people that are coming will be the people that have done something with Sounds of Autism. They believe in what we're doing, that type of thing. But I do want you to speak at that. So I'll let you know when. But Jeremy, I met with him multiple times since he's left Aurora, and he's 45, and he's been through a lot, but he said, he always tells me like, Aurora, if I didn't meet Aurora, I would have never met you. And, and he's so grateful for that. So those are the types of things that we want to discuss with people. And, the meeting the other night, I know you couldn't make it. No problem. We had like 40 people show up and 20 that couldn't. Great. So our team has grown to like 60
That's
people.
Huge though. Yeah. That's wonderful.
But what's really cool is that we have seven or eight autistic adults that are working with us right now, and they all got up and presented that night about what they're doing, and it's so much fun. So
that's so good.
Anyways, okay, so this is the thing. I know we do this once a month, exactly how you did it, just talking about something, and then like I said, we'll pull out stuff that we need as we're doing it. I'm doing an introduction to every podcaster, so my media team's putting that together right now.
Okay.
And then we'll work on all the other stuff, as we move forward. So lots going on.
Okay. Perfect. Well, and an update for you. So for the walk, we hadn't registered yet. Okay. Part of that is that I didn't know if I was going to have coverage for it. So I'll be out of town I'm leaving on the 12th. But I wanted to make sure, because we also were taking part in the Out of the Darkness suicide prevention walk as well. And that's on that Saturday. And so I wanted to make sure I actually am very happy. I just was able to get up to a full team. I have 4 liaisons now. So very happy to be able to have more folks in the community, and I'll introduce more as well as time goes on. And a big part of that is I wanted to make sure that we were going to be able to have some folks there.
Oh, good.
And so, yeah, so I have that confirmed. And so I'll make sure. I think it's actually going to be Debbie, who I think you met at the Glendale.
We love her.
Yeah.
Yes, Glendale. We love her. Can I ask you, does she want a link? And maybe I already sent this to you, a link to be able to sign up a 10-person walk team for free. She gets it for free.
Oh, she can't. Yeah, I think it'd be
I'll
fine.
Send it to you.
Cool.
I'll send everything to you, so you'll have it. You can forward it.
And otherwise, right now, as far as like the sponsorship goes, I'm gonna submit a PO on my end here today. I think, I don't know, I might be able to catch Bruce in time. He's going out of town, but if not, by Monday, I'll be able to get an approval on that and then be able to work with payroll and get that going.
We appreciate it. Thank you very much, and we're glad that you're a part of it. And have a good vacation or trip.
Yeah, it's gonna be fun.
I'll see you, I'm sure, when you get back, but we'll definitely do this again a month from now. And then after that, we'll start talking about what we're doing for this benefit, whatever.
Perfect. Food sounds like a plan. I'm sad that I won't be able to see it in person. It sounds like it's going to be wonderful.
Oh, yeah.
My wife planned the dates, though, so I didn't really have much of a say.
It's okay. I'm glad. Enjoy yourself. Remember, self-care.
Yeah, exactly. It's for everybody. But perfect. Well, I'll give you an update once we have that registration through, and I hope to talk to you soon.
Good job. Thank you very much.
All right.
Bye, Jordan. Have a good day. Bye.
You too.